Jatend mar thieth e pacho ka Dr. Deborah Barasa osingo neno ni okumba mar thieth mar SHIF otiyo e yo makare kendo chiwo thieth e rang'iny mamalo ne ji duto mondikore e bwo okumbano. Ka wuoyo e kinde limbe mar thieth kar thieth mar Ramogi Odinga e kaunti ma Kisumu, jatelono okwayo mondo oganda omed ndikore okumba manyieno kowacho ni chudo ne odewo ofuku mar jopiny. Dr. Barasa bende olimo mine ma okonyore kama ochiwo negi e jipo mar chwalo thieth makare.
JOTRH has received the first payment, the SHIF bill that was pending, and we are happy with the progress in regards to that, and we have assured them that by the end of November they should have their first payment, that is under the Social Health Authority. Following that, we went to see the various departments and the various units, and we started with the radiotherapy unit, where we observed that 8 out of 10 patients were actually registered under SHA with varying contributions from less than 300 shillings. And we were happy to see that patients are actually accessing care in the facility. The maternity unit as well, we have seen the mothers delivering. We have seen with minimal contributions from 300, 450, and we are happy that mothers are actually delivering in JOTRH. Again, the referral mechanism is there. We see the quality based on the statistics and the data they've shared. There is quite progress in that regard. And so our kind request is that we need to encourage SHA registration. So we are calling upon our political elite, we are calling upon healthcare providers, any stakeholder in health, to support us communicate right from the community level, that's the grassroots level, up to the higher levels of care, that it is critical that people register for SHA so that they can be able to access services.